Okie dokie. So it's gonna have to. I can't make this full screen or it won't record the video. It's fine. And the background is disgusting, but we're just gonna do this. Okay. So my presentation is on post-traumatic stress disorder. Yeah. It's cool. It's not cool. Mental disorders are not cool. But anyway. So like about 6 out of every 10 men, or 60% of men, and 50% of women will experience a trauma in some form or some point in their life. These are stats from the National Center for PTSD. I don't know how they're defining trauma because the way you define trauma can drastically change those stats, but that is what I read from that site. And then according to that site as well, 7 to 8% of the population will have PTSD at some point in their life, and 4 to 6% of children will experience PTSD in any given year. It is more likely in women. 10% of women will experience PTSD, and 4% of men will, and 3 to 15% of girls, and 1 to 6% of boys. Is also noted that the types of traumas that cause PTSD are likely to be different among men and women, in that women are more likely to experience sexual violence or abuse, and men are more likely to witness accidents or injuries, physical assault, combat related things like that. Okay, so the DSM, this nice book, lists 8 criteria for someone to meet before they are diagnosed with PTSD, and this is for children and adults ages 6 and up. It's a little bit different for ages 6 and younger, but it's not that different. And so PTSD is something that could be diagnosed at any age. So obviously, the first criteria for meeting the diagnosis of PTSD is to have experienced trauma. Now, this trauma, you're most likely to develop PTSD if you directly experience the trauma. However, you can also experience PTSD if you witness the trauma happening to someone else. So if you witness a severe car accident where someone had died or something like that, that could cause PTSD as well. Learning that it occurred to a close family member, so maybe learning that a family member of yours attempted suicide, and then, or maybe something happening to a child or something happening to a child's caregiver, that could cause PTSD in some cases. And then the other way to experience PTSD through trauma is, or the other trauma is, experience repeating or extreme exposure. So like first responders, EMTs, ambulance drivers, ER doctors, things like that. So you're constantly experiencing other people's traumas that can cause trauma within you. Police officers as well. And then, so different examples of things that can cause PTSD are exposure to war, sexual violence, rape, kidnapping, severe car accidents, domestic violence. Medical catastrophes is interesting. In the DSM, it says medical catastrophes might not necessarily cause PTSD, or they might not necessarily be traumatic, but there could be things associated or happening within those catastrophes that could be traumatic, like going through anaphylactic shock, waking up during surgery, things like that. But yeah, so there's just a whole list of traumas in the DSM, but even there it's noted that you could never possibly list all the traumas that could happen. So really, you don't know what could cause PTSD in someone, but we do know that it happens. And also, I don't know if I said this, but PTSD is a trauma and stressor related disorder. So it is caused by the trauma, it is because of the trauma, and it causes a lot of stress in the person, which causes the symptoms of this disorder to occur. And the symptoms of this disorder are, first one, the most common one that people know about and talk about, is intrusion symptoms. So this is where your flashbacks, your night terrors, things like that would occur. These are just like the memories keep coming back. And In children, this could occur as repetitive play. You know, a little girl who was raped might play pretend with her dolls, that her dolls are being raped, or like things like that. Yeah. This could also be have dissociation. Like people could experience flashbacks and have complete loss of where they are, what they're doing. So the common example is someone who is a veteran of war hearing a gunshot go off, and then suddenly their memory, they're transported back to the war zone and they don't know where they're at. They don't know what's going on. For a lot of people, PTSD usually isn't, or the symptoms, the flashbacks usually aren't that severe. The best way to explain a flashback that I've heard explained is if you've ever walked past a bakery and you like smelled bread and it takes you back to like making bread with your grandma. That's a good memory, and it takes you back and you can like see her kitchen and the flour on the table and things like that. You know, it takes you back to the good memory, and then you feel the way you felt during that time. So that's pretty much what flashbacks are like, except they're bad memories. Not something that you would want to re-experience. And because of that, the next symptom is avoidance. So you try to avoid any like internal ways of re-experiencing the memory. So you're trying to avoid the triggers, and you're also trying to avoid external things that cause the memories. So you're trying to avoid any triggers that can cause the memory. You're trying, if you were bit by a dog, you'll try to avoid dogs. You know, you're trying to avoid the memories, the thoughts in your head, the memories that keep replaying, the dreams that you keep having. You're trying to avoid anything that could make you think about the trauma that you had gone through. The next symptom is negative alterations in cognitions or mood, and this starts after the trauma, or it becomes worse after the trauma. So someone with depression, it might become worse after the trauma occurs. And so this can have amnesia, persistent and exaggerated negative beliefs against themselves and expectations to get for themselves or others. So they might believe that everyone is out to get them, or they might believe they're the worst person alive. That everything that happened to them was because it was their fault. They're very negative in their emotional state. They might feel detached. They might have, they might be not as interested in things that they used to enjoy, things like that. The next symptom is alterations in arousal or reactivity. So this can be irritable behavior, angry outbursts, being very hypervigilant. So walking into a room and immediately looking for all the exits and planning 8 million different escape routes for what they would do if something occurs in this room. Having an exaggerated startle response, being easy to startle. Problems with concentration, disturbances in sleep, and then the duration has to be for at least a month. And then the disturbance has to be clinically significant, cause clinically significant distress, and it cannot be attributed to substance abuse or another medical condition. It should be noted, it says substance abuse or medical condition. It doesn't say another mental disorder, because PTSD can be comorbid with almost any mental disorder. And having another mental disorder does not prevent you from being diagnosed with PTSD. Because again, if there is trauma, that's likely the cause, or at least in part, might be worsening the other mental disorders that you have. Okay. So then also there are 2 specifiers for PTSD. So one is people with dissociative symptoms. So these can be in the form of depersonalization, so feeling detached from one's body, dreams, derealization, feeling like the world around them isn't real. It's a fake place. It's dreamlike. It's distorted. Yeah. And to be able to use this specifier, you have to make sure like the symptoms can't be attributed to substance use or another medical condition. because, some substance use could cause you to dissociate. Yeah. And then there's another specifier for whether or not the symptoms were delayed until 6 months after the trauma had occurred. So, sometimes PTSD doesn't occur until years later, and they start to relive the trauma again. And maybe some of the symptoms of PTSD were there from the beginning, but not enough to be diagnosable, or not all of them. So that's also something to note clinically and to know about. So then, PTSD can be diagnosed at any age, although for children 6 and under, the symptoms are listed slightly differently in the DSM, not that much. So for ages 6 and under, the section about negative alterations and avoidance are combined into one, meaning that both, one of those symptoms must be present, but not necessarily both. And then it also notes that different ages may present symptoms slightly differently. So again, children might reenact through play. And then it also notes in the section about children that witnessing something traumatic happening on TV or in the media cannot cause PTSD. It has to be something that they witness in person. Yeah. Cool. And then differential diagnoses. So things that you could be diagnosed with aside from PTSD. So acute stress disorder. It's not quite the same as PTSD, but it has almost all of the symptoms of PTSD, except the symptoms haven't occurred for a full month. So sometimes people go through a traumatic event and they have all of the symptoms of PTSD, but then maybe after 2 or 3 weeks, they go back to things settle down and the symptoms go away once they deal with and cope with the situation that they're in. If it lasts prolonged, more than a month, then it would be diagnosed as PTSD. So that's the only one on this list that cannot be comorbid with PTSD, because it's kind of a precursor to PTSD for some patients. And then other ones that are diagnosed sometimes, adjustment disorder, anxiety or OCD, OCD, major depression disorder, traumatic brain injury, personality disorders, substance use disorders, etc., etc. And then, again, any one of these on this list, except for acute stress disorder, could be comorbid with PTSD. Yeah, and then according to the DSM, people with PTSD are 80% more likely to have symptoms meeting at least one other mental disorder, which, if you review the symptoms of PTSD again, you can find that there's a lot in common with other disorders within them. A lot of the symptoms overlap with other disorders as well. Males are more likely to present with substance use disorder and or conduct disorder, and females are more likely to present with depression or OCD. But then also, males and females may present their PTSD symptoms slightly differently. And then also, something noted in the DSM that I found interesting was 48% of military personnel or veterans with PTSD also have mild to severe traumatic brain injury, which was something I had never thought about, but it makes sense. It's interesting. And then risk factors that could cause someone to develop PTSD are their environment. So being in a poor environment, not having a good support system, that can, and then going through a traumatic event, that can make it harder to recover from that. Having a history of mental illness, either in yourself or in your family, can put you at higher risk for developing PTSD. Having poor coping skills, and then also having a history of substance abuse. All of these things can put you at a higher risk for developing PTSD should you go through a traumatic event. And then some protective factors that can help prevent you from developing PTSD is having a healthy support system, having good problem-solving skills, being able to self-disclose, so to talk about your trauma, because if you're not